Hi everyone, this is Sarah from Body Mechanics Rehab and Wellness, and this is our new therapist, Ashley. Ashley is a craniosacral therapist, and today we are talking all about TMJ. So for those of you who have temporomandibular joint pain, this episode is for you. So welcome, Ashley. Thanks for being here today.
Thanks for having me.
Okay, so tell us a little bit about yourself and how you got introduced to craniosacral therapy.
Sure. So I've been a nurse for 15 years, and I was pregnant with my third child when I started having really terrible migraines. I went and did a lot of other alternate options for treating that, the normal ones, and then, those weren't working, so I went down another avenue. And it was recommended to try craniosacral therapy. So I did a couple sessions. I had after the first session, probably half relief, and then 2 or 3 sessions, like complete relief. So that was when I was first introduced to it. Life just kept bringing me back to it with my kids, especially my second son, just with his mouth issues. And I was like, well, I need to probably learn more about what this is, get some training on it. And the more I learned about it, I just realized how helpful it can be for people that are really, struggling or have tried all of the normal paths for trying things, and it just hasn't been working. So yeah, that's how I started with it. I've really enjoyed it, and it's a great option for people.
Funny how things come back around and they're
Right.
like, oh hey,
Yes.
my old friend, craniosacral therapy.
Yes.
Interesting. Okay, so tell us a little bit about what craniosacral therapy is.
Yes, so it's a gentle hands-on therapy, and it helps just your body to work how it's supposed to work. It helps with clearing out different restrictions that can affect how your nerves function in your body. All of our nerves come out of our spinal cord and they go to the rest of the body. So usually if there's a restriction there, it can affect how the rest of the body's functioning. So it just helps to release those pretty much. So you have membranes in your body that hold your organs, and then fascia that are like collagen filaments that go throughout your body. Anywhere where those intersect, there's a chance of collision. So that just basically is helping to release those collisions and getting the body to work how it should.
It's like the saran wrap around your muscle fibers that get stuck to things it shouldn't get stuck to, you
Right.
know?
Yes. So,
Interesting. Okay, so how does craniosacral therapy work on the body? Like, what does it do for the restrictions? Does that make sense?
yeah, so it just helps your nervous system to function better. You have cerebrospinal fluid that goes from your brain down to your sacrum through your spinal cord, and so basically it's helping to get that to flow through it. There's lots of it's a pretty amazing system. It's really intricate, but the basic premise, I guess, just to make it simple or a little more easy to digest, is your cerebrospinal fluid. It helps to have all those areas work properly. There's also toxins that get filtered out through that, and if there's any restrictions, especially in the cranium, where those membranes can get tight or affect how that flow is going, some of those toxins can get built up, and it can cause brain fog, migraines, lots of other things. And so those are the main functions of it. So it's just helping that system to pump appropriately or pump effectively.
Interesting. Sounds like I need that. Okay, so for TMJ specifically, tell us a little bit about how that works.
Yeah, so TMJ, it's really mostly like muscles that are tense. It can be from grinding your teeth, it can be from stress. A lot of times though, like probably 90% of patients that have TMJ, there's something else going on in the body that's affecting that too. So it's not always just localized in the jaw. It could, a lot of times the jaw and the hips they correlate. So if you have tight jaw, you most likely have tight hips too. So that's, when we work on the whole system, it helps everything to work versus just
one
one
thing.
at a time. Yeah.
That's interesting. I know that when I had TMJ, I started, I am a person who sleeps kind of on my, like with the pillow here with one arm up. But I noticed that my hips would be turned so that my knees would be sideways, but then my shoulders would be straight down into the bed. And so that's really interesting because my hips were really tight at that point. And I changed how I was sleeping, put a pillow between my knees, and then started doing a lot more stretching. And so I bet that had something to do with it. Probably craniosacral therapy had something to do with it also. Okay, and let's see. What other things am I missing? Is there anything else you want people to know about craniosacral therapy and TMJ pain?
I mean, a lot of times people have had TMJ pain for years, so it's, you know, something that is, you know, progressive. Or with the sessions, you may not receive immediate relief. It may be partial relief, but it may take time. So, you know, don't feel discouraged if you do try craniosacral therapy and you don't get that immediate relief. It may take a few sessions. I usually tell people give it like 3 to 5 sessions and see how you're feeling. You know, and then, you know, it's always important to make sure you're drinking plenty of fluids afterwards because you're moving a lot of things around that could also start to release some of those toxins, and you want to make sure that you have enough fluid to filter those out too, because give it like a day and a half afterwards before you kind of like feel like, okay, I'm starting to feel some relief too. So but yeah, it's something that I think it can help with a lot of different things, but TMJ especially for people too. So
awesome, very cool. Well, thanks for being here today.
Yeah.
And if you have any questions, let us know. Leave them in the comments, and we will be in there answering questions and things like that.